In this world, if you can see an opportunity to make a big change, and you put fear aside, you put self-preservation aside, and go for it, magical things happen.
Ali was a student in my entrepreneurship course for science and engineering PhD students and MBAs, and he was a superstar.
He was very sensitive to building a culture at Zymeworks, and it's really been that culture that sustained the company over the last 22 years.
He recognizes the strength of people. He actually provides a lot of freedom for people to grow.
He takes building a culture that's supportive of the people in it very, very seriously.
I admire Ali for his intelligence and his integrity, his humanity, his skills, and his desire to make a difference.
Zymeworks was really started at a time where the people are starting to really understand and apply computational methodologies. Can you use a computer, be able to make better proteins, make better therapeutics?
I can't think of another platform that generated as many partnerships with large pharma.
Zymeworks as a biotech company need prodigious amounts of capital to support the drug development to be able to help ultimately with the cancer treatments that Ali had focused on for many years. And quite simply, by a stock market listing, it's access to a much, much deeper pool of capital, and it then allowed the company to start positioning itself for the next stage of its development.
We all are patients, whether we know it or not, or our time has come or not. How great it would be for someone to say, we got this. And at that moment, I realized all of us at Zymeworks, could be a part of that.
He was making a very bold effort, and that was to enter the HER2 market where you had behemoths, drugs like Herceptin doing $7 billion plus in sales at the time. And he was really focused on improving the standard of care for patients. Not all HER2 expressing cancers were being served by the first generation of drugs. And I really saw an opportunity for a next generation therapy, this biparatopic antibody that Zymeworks has developed, and really the unmet need both in patients who are progressing on existing therapies, as well as patients with biliary tract cancer that weren't really receiving these important medicines.
To have a drug that doesn't make you nauseous, that doesn't add to the things that your cancer is already causing, and that can make that cancer shrink, that's phenomenal.
The very first patient that was dosed with zanidatamab was a mother that was essentially out of solution. And coming onto the Zani trial was last hope. She went on to stay on Zani for greater than a year when all else had failed. Our work enabled her to be with her children. It was very emotional.
As with most development stage biotech companies in our space, Zymeworks has gone through ups and downs. During the down periods, which were largely driven by market conditions, Ali's leadership was very calm in the middle of a storm.
I left Zymeworks in 2022.
Ali's transition out as CEO of Zymeworks was really handled in a seamless way as Ken Galbraith took the reins.
Ali's decision to step down was a big punch to the gut for many of us. I think at that time, I've worked with him for over 15 years. We grew together, we learned together, and it was very hard.
Ken has taken the company forward into the next chapter very well, and this was really set up by Ali's willingness and humility in the decision to pass the baton, which isn't always an easy decision.
It was an incredibly difficult decision. It was very emotional, but the right decision.
Zymeworks needed a partnership because it couldn't raise money to complete phase 3 trials, and then that drug would have languished.
Very early on, we knew that getting Zani in the right hands was the best thing to do for Zani. The question was who? The Jazz deal was very important because we knew that bringing a drug to market, especially in HER2-positive cancers, is not a simple task.
Placing zanidatamab as a key centerpiece in their oncology portfolio is very exciting. Working with a global partner had experience with commercializing, selling, and marketing a drug in a fairly competitive market means that patients have a chance to actually be prescribed the drug from doctors.
The involvement of Jazz created an opportunity for zanidatamab to be successful, and that in turn was a comeback for Zymeworks.
In November, when I saw the announcement that the FDA had accelerated approval of Zani, it was an unbelievable moment.
They have an approved drug. Yeah, how rare that is for a little company.
You can always have naysayers who say, well, you've developed something and it's gone into trials, you've raised an awful lot of capital, you've built a company, you have all the attributes around you. However, until you actually get that ultimate approval by the FDA, it's very difficult to say, have we truly built this success? When the drug has been approved, yes, you really have.
Ellie's really created a sustainable biopharma powerhouse that originated in Canada.
The model that we always had was, we want to bring patients home to their families, and this drug does that.
This is one of the best things that one can do to achieve a type of immortality, to help someone to mature and create something that will outlive you. I'll take that over a Nobel Prize anytime.
Less than 10% of ideas make it to the clinic, and less than 1% make it out of the clinic successfully with an approval. And we did it against all odds. And I felt proud to have had a part in it.